Virtual Reality and Physical Therapy Education, Rehabilitation. Title: Virtual Reality and Physical Therapy Education, Revolutionizing Rehabilitation. Introduction. In recent years, virtual reality, VR, technology has transcended the realm of entertainment and emerged as a powerful tool in various industries, including healthcare. One particular area in which VR has the potential to revolutionize practices is physical therapy education and rehabilitation. With its immersive and interactive capabilities, VR offers unprecedented opportunities for therapists, and patients to enhance the effectiveness and efficiency of rehabilitation programs. This article explores the integration of virtual reality technology into physical therapy education and how it is transforming the landscape of rehabilitation. 1. Understanding virtual reality in physical therapy education. Virtual reality refers to a simulated experience that can be similar to or entirely different from the real world. Through the use of specialized headsets, gloves, and other peripherals, individuals can be fully immersed in a digitally created environment that mimics real-life situations. In physical therapy education, VR allows students to experience simulated patient scenarios, translating the theoretical knowledge into practical skills and enhancing their understanding of patient care. 2. Enhancing engagement and motivation in rehabilitation. One of the key advantages of VR in physical therapy education is the ability to enhance engagement and motivation among patients. Rehabilitation can often be repetitive and tedious, and many patients lose interest or become unmotivated over time. By using VR, therapists can create interactive and dynamic exercises that stimulate both the mind and body of patients, making the rehabilitation process more enjoyable and rewarding. For instance, a patient recovering from a stroke can use VR to simulate activities of daily living, such as cooking or gardening, within a safe virtual environment. This not only promotes physical movement but also encourages cognitive involvement and emotional engagement. By providing patients with a sense of accomplishment and progress, VR can significantly increase their motivation to actively. Why participate in their rehabilitation journey? 3. Improving motor skills and balance. Motor skill and balance training are crucial components of physical therapy rehabilitation programs. Traditionally, therapists used basic exercises and physical aids to improve these areas, but VR offers a more immersive and targeted approach. VR simulations can recreate various scenarios that challenge patients' balance and coordination, helping them improve their motor skills in a controlled, virtual setting. For example, a patient with postural instability can use VR to practice maintaining balance while standing on a virtual uneven surface, such as a sandbag or a moving platform. With real-time feedback and guidance from the virtual environment, patients can develop better proprioception and coordination, ultimately translating those gains into improved physical performance. 4. Reducing anxiety and fear. Fear and anxiety often hinder the progress of rehabilitation, primarily when patients have experienced traumatic events or have a fear of certain exercises. VR technology enables therapists to create virtual environments that gradually expose patients to their fears, helping them overcome anxieties and progressively regain confidence. For instance, a patient with a fear of heights can practice virtual scenarios involving heights, gradually increasing the intensity and complexity as they build their tolerance. 5. Facilitating remote rehabilitation and accessibility. Another significant advantage of VR in physical therapy education and rehabilitation is its potential to overcome barriers related to distance and accessibility. Remote rehabilitation is an emerging field enabled by VR technology, allowing patients to receive therapy from the comfort of their homes while connecting with therapists remotely. VR-based rehabilitation programs enable therapists to monitor and guide patients in real time, ensuring that exercises are performed correctly and with adequate intensity. This not only increases convenience for patients, reducing travel time and costs, but also promotes continuity of care, minimizing dropouts and interruptions in the rehabilitation process. 6. Ensuring personalized rehabilitation programs. Every patient is unique, with specific needs and challenges. Virtual reality technology in physical therapy education allows therapists to create personalized rehabilitation programs tailored to each patient's requirements. By analyzing data collected through VR simulations, therapists can track patients' progress, identify areas of improvement, and modify treatment plans accordingly. For instance, a patient recovering from a knee injury may have specific limitations in movement and strength. Using VR, therapists can design exercises that target those specific limitations, monitoring the patient's performance and adjusting the difficulty level as needed. This personalized approach ensures that patients receive the most effective and efficient rehabilitation, optimizing their recovery outcomes. 7. Enabling multi-sensory stimulation. In traditional physical therapy, therapists primarily focus on targeting specific muscles or body parts. However, rehabilitation is a holistic process that involves multiple sensory inputs and interactions. Virtual reality technology allows for multi-sensory stimulation, engaging different senses simultaneously to enhance the rehabilitation experience. For example, a patient with a spinal cord injury can use VR to participate in a simulated swimming program. The VR headset provides a visual representation of swimming movements, while haptic feedback gloves simulate the resistance and feel of the water. 8. Training therapists in innovative techniques. In addition to transforming patient rehabilitation experiences, virtual reality technology has the potential to revolutionize the training of physical therapists themselves. VR simulations allow OSP ring therapists to practice various techniques and interventions in a safe and controlled environment before working with real patients. Suppose a physical therapy student wants to learn how to handle a patient with balance issues during a fall prevention exercise. VR can recreate scenarios and